Hey everyone, here's an update on the coronavirus COVID-19 story as it applies to Fayette County, Georgia. On Monday, the Georgia Department of Public Health was awaiting confirmatory testing from the Centers of Disease Control and Prevention, the CDC, on 5 additional presumptive positive cases of coronavirus COVID-19 in Georgia. The additional cases were in Cobb County, Fayette County, Gwinnett County, and 2 in DeKalb County. The individuals were hospitalized and the sources of their infections unknown. Confirmed cases of COVID-19 and presumed positive cases of COVID-19 are broken down by county as follows. Confirmed COVID-19, 6. Fulton County, 3. Floyd County, 1. Polk County, 1. Cobb County, 1. Presumptive positive COVID-19 cases, 11. Fulton, 2. Cobb, 3. Fayette, 1. DeKalb, 2. Gwinnett, 2. And Cherokee County, 1. Well, Fayette 1 has to be updated to Fayette 5. On Wednesday night, I was informed by a source close to the subject that there are 5 people who are what was called presumed coronavirus COVID-19 cases, and they were housed at Fayette Piedmont Hospital here in Fayetteville, Georgia, and not far from Pinewood Studios, Atlanta, Fayetteville, Georgia, movie studio. My source further explained that they're in a special area and that 10 hospital staffers were sent home as a precautionary measure to, quote, see if they got symptoms, unquote, said my source. So this news tells us that the spread of coronavirus COVID-19 is wider than we know. Additionally, you have to ask, well, what is coronavirus COVID-19? It is described as a disease that is caused by a respiratory virus that was first identified in Wuhan, Hubei province, China. While it's said to be a new virus that hasn't caused any illness in humans before, that may be because of its rumored controversial origin. At the Wuhan Institute of Virology, a subsidiary of the state-owned research institute, the Chinese Academy of Sciences, combined with absolutely complete lack, and I've checked, complete lack of any other solid contrary story pointing elsewhere. All roads lead back to the Wuhan Institute of Virology or a live market that's only a few miles away from it, where the person who was said to have first showed symptoms of COVID-19 was. The Wuhan Institute of Virology is where the SARS virus escaped on several occasions. COVID-19 is spread just like the cold or flu through coughing and sneezing, which creates respiratory droplets, close personal contact, such as touching or shaking hands, touching an object or surface with the virus on it. And the state of Georgia asks you to do the following to help stop the spread of the novel coronavirus causing COVID-19. And the state states this, that the overall risk of COVID-19 to the general public remains low, although elderly people and individuals with chronic medical conditions may have an increased risk for COVID-19. The best prevention measures for any respiratory virus are wash your hands with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay at home when you're sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. If you have recently traveled to areas where there are ongoing outbreaks of COVID-19 and you develop fever with cough or shortness of breath within 14 days of your travel, or if you had contact with someone who is suspected to have COVID-19, stay home and call your healthcare provider or local health department right away. Be sure to call before going to a doctor's office, emergency room, or urgent care center and tell them about your recent travel and your symptoms. Subscribe to Zenny62 on YouTube and bookmark oaklandnewsnow.com.